Come on in. Come on in. I know it's late, but y'all can catch the replay. I was like, let me just come on here for a little bit. Because a few of my cousins are upset at me about this post-op of the care and how y'all wearing these garments. Oh, no, no, no. I'm eating yogurt, y'all. Trying to gain some weight. Trying to gain some weight. I'm trying to gain some weight. Real late, real late. I'm trying to gain some weight for this surgery. Y'all, I'm up late, okay? I'm always up late. Come on in. Because I don't want my phone to die. I'm going to give 2 more minutes. I mean, 1 more minute. Because this will be like a 15-minute vlog. Happy Thursday. Happy Thursday. Well, it's about to be Friday in 30 minutes. All right, we about to go ahead and start. Stroke it for me. I don't know, people gonna be inboxing me tomorrow talking about, I missed your live, girl. I was asleep. I don't know, should I go live again tomorrow? Maybe, possibly. All right, what's up, you guys? It's your cousin Krystal bringing you another video. I was trying to wait till I got some people in here, but everybody's gonna have to catch the replay game. Okay, so y'all seen the title of the video. It's like I gotta take y'all all the way back. I have to take y'all all the way back because so let me tell y'all what happened. Let me tell y'all what happened today. One of my cousins reached out to me and she basically asked me, she basically sent me a picture. I ain't gonna say your name. She sent me a picture and she was asking me about post-op garments and stuff like that. When your faja tends to start feeling too loose after surgery and you didn't put your faja on after surgery, or when you basically, maybe it's just, I don't know, because some people lose weight fast after surgery. Literally, a lot of people lose weight fast. You're walking, all that fluid and stuff is just coming. It's the swelling and the inflammation, everything is just coming down. Like, it's just, you know what I'm saying? So when you tend to start losing a lot of weight like that, you tend to see it in your face first. You always tend to see it in your face. Of course, you're going to notice the swelling in your legs is going to decrease. The inflammation in your legs and everything is going to go down with those compression socks. Let me tell y'all something. I know y'all be saying that y'all do not like wearing those compression socks. You need to be wearing those compression socks because those compression socks are helping you with that inflammation and that swelling. Especially if you done had thigh lipo, you can get the ones that come off, I think, like halfway up to your thighs. Oh, excuse me. And they have the arm compressions too. If you have an arm lipo done, you want to invest in those. They sell them on Amazon. If you need the link, I will send it to you. Just inbox me or message me on here and I will send you the Amazon link. Because I get tired of, after y'all have surgery, especially for the people that have the arms, you go through all that pain You go through all that pain to have arm lipo just for you to not be wearing your compression garments. Let me tell y'all something, especially for my newbies, for all of my new cousins that are having surgery that's never had surgery before. The first time, trust me, I was once a newbie. The first time, you're not gonna like wearing that faja. You're not gonna like getting into it and getting out of it every 30, 45 minutes, because you have to either one, probably go use the restroom. You probably, some people can't really just bend down like that to unzip, so they just get out of everything. Some people get out of it, you know, you have to take a wipe off or a bath, then you have to take it off so you can get a massage done. So I say that to say, please, we have to stick by our fajas. I don't see how y'all doing it, because with my BBL, when I had that faja on to take it off, yeah, it did feel a little bit soothing, but then it felt like I was bloated. You get what I'm saying? So it felt so much better to get right back into that faja immediately. You don't want to stay. I don't care what these girls out here doing. You done paid too much money to be out here and not in your faja. Okay, I want to touch bases on that. Also, I want to touch bases also on fajas, as far as, okay, after surgery, when you start losing inches. Let me let y'all know something. When it start getting loose in this area, matter of fact, on my next video, I'm gonna get into my fajas so I can do a live demonstration, because I like to be hands-on with y'all, because I need for y'all to be doing this stuff correctly. Okay, I still have my stage 2 faja from my surgery from a year ago, and I'm going to keep that faja because it is great material. It's by Snatch. I got it from Vixen. It's in great material. And I may have to get it taken in one more time when I have my next surgery. So I'm definitely going to keep that faja. So basically with the faja, when it start feeling snug, like loose in this area, I'm talking about snug. When it start feeling too loose in this area, oh no, baby, it is time to get it taken in. And if anything, you should be proud of your improvements. You should be proud of it, because that means you're doing something right. That means you're walking like you're supposed to. That means you're staying hydrated. That means you're wearing your compression foams and your boards. Let me tell you something right off the back, especially for my tummy tuck patients, and I don't see this enough on YouTube. You do not have to wear that board right off the back on, because you have to realize when you get a tummy tuck, you are getting a muscle repair. Okay, you're getting a muscle repair. You have been cut open. Okay, from here to here, you have been cut open, and you have dissolvable stitches. I don't know, like some patients out the country, some of them, they have staples and some have stitches that they have to go back and get taken out. I can say for some of my well, for my last surgery with Dr. Triggs, all of my stitching around my navel, my nipples, I had to get some of them removed. I had to get some of them taken out, and they was halfway like poking out, but they wasn't dissolving all the way. So I had to have my nurse here in Houston manually, hands on, with her pliers, her medical pliers. She had to, you know, and then she cleaned them real good, banished them up. I can say they closed up probably within a few days or whatever. I didn't get an infection. Let me tell you something. When you are handling your self-care when it comes to your wounds after surgery, you want some, I don't care if you're doing this to yourself. You want to make sure your hands are clean. If anything, I don't care if you just washed your hands. I will put gloves on, especially if you're dealing with a tummy tuck. That's how a lot of people are getting infections. It's not always the doctor, the reason why you're getting an infection. Some people are getting infections from where they go at the post-op, wherever they're staying, the area is not clean or sanitized. Some people are getting infections because of themselves. They're not washing their hands. They're not being clean with themselves. You have to be clean when you are messing with those sutures, because you do not want to get an infection and end up in ER. Okay. Now, back to the faja thing. Okay, so when it comes to the faja, whenever you feel like you are getting loose in this area, you always want to go and try to get it taken in. Let me tell y'all something. I know y'all be ready for y'all waist to be snatched. Trust me, I'm right there with you, okay? But you have to trust the process. When I say trust the process, that means thinking clearly and thinking logically, okay? Your waist is not going to be snatched the first day. Your waist is not going to be snatched the first week. Now, the first week, can I see a change or a transition in my appearance? Yes. But will I be 100% to where I want or where I need to be? No, of course not. That's why they say when you have a BBL, do not sit for the first 12 weeks. If you have to sit, by all means, if you have a driving job, just make sure you are sitting on the proper pillow. Make sure you are never sitting on hard, flat surfaces if it is not any cushion. Let me say that again. Make sure you are not sitting on hard, flat surfaces if it is not cushion. And let me tell you something, still to this day, like this chair I'm sitting in, it has cushion, but if I'm sitting here longer than 45 minutes, and that's why I be trying to rush to get off the phone with y'all, because I don't know, still to this day, and I'm 2 years post-op from my first BBL. If I'm sitting too long and I have a sit down job and I'm sitting all day, I stand up periodically because I cannot. I don't know. It just feels weird to sit. So trust me, when you get your BBL, if you already had a BBL before and you're getting ready to get another BBL, it should be smooth sailing. It should be smooth sailing for you, as well as it should be a breeze. Even though I know every surgery is different, but at least you know what to mentally prepare for. Now, I keep getting off of these fajas. Okay, so when it comes to these fajas, let me tell y'all something. I'm going to get back on the waist. Y'all be wanting y'all waist to be snatched on the first day. Y'all get in the mirror. And that's my thing, too. I had to tell myself to get out of the mirror. Get out of the mirror. Of course, you're going to see a big difference, especially if you've never had no ass. First of all, you're going to see a tremendous big difference. You're going to be like, okay. And then especially if you didn't had other stuff done, like you probably didn't had a breast lift, you probably didn't had some stuff done to your arms. Of course, we want to glance a little bit and look, but as far as like constantly pounding yourself to get up and look in the mirror, we got better things to do, because then you know what happened then you're gonna keep looking in the mirror and you're gonna tell yourself, oh, something ain't right there. See, I'm gonna need a revision. You get what I'm saying? Then you start thinking all these different negative things. We cannot be, we cannot be in this mirror all day, y'all. We cannot be in this mirror all day. While you in that mirror, you need to be making sure you're putting them foams in that faja. Okay, so back to, if your faja is loose in the middle area, and you are not putting your foams in there, please put your foams. Like I said, if you had a tummy tuck, you are not forced to put a board in the front of your stomach, okay? I would not ever tell anybody that. If anything, you can put a board in your back if you want, because of course you had Lipo 360 or you had two flanks with that tummy tuck, you're definitely are going to need compression in the back. And that's one thing that I need to invest in, or better yet, I need to investigate. What about the people that actually have tummy tucks or just simply Lipo 360? I know they have the 3 ab boards, but that's just left, right, and front. What about the back area? Because isn't that our main concern? Mainly, like after we have surgery, we are concerned about that back fat. So I don't know. I'm just trying to figure out a better way on how to compress my back this next round, because I really want my back to be as flat as my front, if that makes sense. Because we should still have a lot of fat back here. And like I said, even with the faja, even though it's compressing a little bit, I feel like in the back, but we can't do it by ourselves. That's the only tricky thing about it, because in the back, I wouldn't mind putting 2 foams back here, because you know, right here and right here, that needs compression. So I feel like if you have somebody that's with you that can help you, like just hold those 2 foams in the back area while you pull your faja up, and then you buckle it up. You got your foam here, you got your foam here, and you got your foam here. Do keep in mind, in most of these foam packs that you order off of Amazon, I think the most common one pack is like 3 to 4. So if you're going to do that method with putting 2 here, One on the side, one on the side, one in the front. That's actually 5. You may want to invest in getting 2 or 3 packs, especially if you fresh out of surgery and then you ruin them with the blood. Because I've never washed those. I don't know if they're washable. I've always disposed of them because I was afraid of infections and stuff like that. So whenever I had one, if I got blood on them or anything, because I mean, they only $9 for a pack. So if I got blood on them or anything, I never washed them. I always threw them away. Now, if they do have the washable ones, I'm gonna look on Amazon to see if I can find those because that would save me a lot of money. But truth be told, you only bleed in the first 2 to 3 days due to them reopening up your holes and they're doing your massages. So you shouldn't be constantly bleeding like that. And from your tummy tuck, you definitely should not be bleeding because why? Because we're not touching our tummy tuck sutures. We're not doing anything with our tummy tuck. We are just making sure it stay clean. We're making sure that we are not infecting it or anything, or we're not getting it wet. Remember, when you have a tummy tuck and you're using that paper tape, if it does happen to get wet while you are freshening up or cleaning yourself or anything like that in that nature in the restroom, you can always get a blow dryer and put it on low. Don't apply it directly. You're gonna hand it you're gonna actually have it maybe a few feet from, not feet, but you get what I'm saying, a good angle um from the stitching, and then just just take your time because the wrong move will be the wrong move. Okay, you want to make sure it's completely dry because guess what, we don't want no infections. Okay, and then we're quick to blame it on the doctor when actually it was you and you was doing something that you didn't wasn't supposed to be doing. Okay, so back to these fajas again. So basically, once you have already completed that stage with putting foams in there and it's getting even more loose, congratulations, because baby, guess what? You're going down in inches, honey. Okay, you are going down in inches. Whenever you have still that good of amount of space after you have removed your foam boards and your hard board, oh my goodness, it's time to get that faja taken in, or you can go ahead and get you a stage 2 faja. You can go ahead and get you a stage 2 faja. For alterations on fajas, you have to Google in your local state, or you can get your measurements taken and just drop it off at an alteration place, or you can take it to like a faja place and they'll actually do your same day measurements. I don't know if they will let you pick it up the same day, but at least they'll go ahead and take it in 2 inches. Usually they'll take it in from the sides as well as in the front area. Okay. For me, it was so much better for me to have the zipper at the bottom. Some of these fajas, that's why you have to pay close attention and make sure that I don't know. I love a great authentic Colombian faja. Okay, you can tell the difference by the material, the stretch, how it makes you feel, the thickness, everything. And you're not going to be uncomfortable. Once you break that faja in, it's curving to your body. That faja is specializing and it's curving to your shape and to your body. Okay. Another thing. So once you do go ahead and get it taken in, then I mean you on stage 2. Now, once that one start feeling loose as well, and you and already started using your foams and your boards, it's time to either get that one taken back in, or if you want to go ahead and get a stage 3. I've never went and got a stage 3 faja because I believe in just taking my faja and getting it taken in. So my stage 1 faja, I wore for my stage 2, and then I went and bought an actual stage 2 faja, and I got it taken into a stage 3. So I only purchase every surgery. I only purchase 2 fajas per surgery, and they last me my whole year of my recovery. Now, let me tell you something. Some people do wear their fajas for the 12 weeks, and then some people only wear their fajas for 3 months. Some people may wear their fajas for 6 months. Some people may even do the whole year. Me, I think I did like roughly 10 months on and off. Basically, for me, the first 3 to 4 months, I was hardcore 24 hours wearing my faja. After that, then I started doing either the morning, wearing my faja for 8 hours, or at night, sleeping in my faja. I preferred wearing my faja in the mornings so at night I can be extra comfortable and I don't have to worry about if I do happen to need to get up in the middle of the night. I gotta turn on all these lights and I gotta do this. And by the time I do all that, I'm gonna be awoke. I'm gonna be awoke because it's just like with me when I get up at 6 in the morning to go use the restroom, I'm like, oh my God, I'm trying to go back to sleep. And it takes me a while to go back to sleep. So I noticed that by myself now that I'm getting older. I can't fall back to sleep that fast. So I took it upon myself. Now, if I have to get up with that faja, I'm going to take it off at this point. I'm just going to take it off. And then, oh my God, I seen this TikTok. This girl was talking about on TikTok. She supposed to be wearing her faja. She's only not even 4 5 weeks post-op, already drinking. Let me tell y'all something. It is a lot of sugar in alcohol. It is a lot of sugar and alcohol. Alcohol causes you to have high blood pressure. It causes inflammation. It causes a lot of things that we are not aware of, or maybe we are aware of, but we just saying, oh, I'm just going to do it this one time. One time is all it can take. All that compression that you have done and everything that you have endured during this process, you don't have anything to show because you didn't already started drinking too early. You already started smoking back hookah. You started doing all these things that you was not doing right before leading up to surgery. So let me tell y'all something. If y'all want to have a healthy recovery without going to the ER, wear your garments, stay hydrated, continue to walk. I would even say like once you get, especially like after the third day, I understand the first 2 days be kind of shaky. It's a hit or miss. But you at least need to walk at least twice those days. Because I understand the first day you're still under anesthesia and stuff like that. So I give it the third day. Whenever I'm with my patients out there in Miami, the third day, I let them know that they're going to be more independent on the third day. On the third day, of course, I'm still going to assist you with baths and stuff like that because I don't need you getting dizzy or falling out. I'm still going to monitor you. But I have to teach you independency because guess what? When you get back to Detroit, when you get back to Chicago, wherever you going, you're going to be by yourself if you don't have companionship, if you don't have older children to help you, if you don't have a mom or a sister that's willing to help you or a good friend. You're going to be there by yourself. So we have to figure things out, okay? And so my job is to try to educate you all, whether it's virtually or in person, so that way you can have a healthy and a smooth recovery, post-operative recovery. Now, I try to focus more on fajas instead of waist training because a lot of people get it confused, okay? When it comes to waist training, you want to be very careful. I had to get on a cousin about that today too. And that's what really made me want to go ahead and make this video because a lot of young women are not aware. You see all these celebrities wearing these waist trainers. I don't care if they just had BBL shots, Lipo shots, BBL, fat move to the hips, whatever. You want to be careful. We are not supposed to be waist training before 14 to 12 weeks. We should not be waist training because our body is still molding. Your body is still molding. And by you doing that, you are messing up your surgery. And then you're going to find hiccups along the way. You probably going to find lumps here and there, and you're gonna find something and you're gonna be talking about you need a revision. Oh, the doctor ain't lipo enough here. Or no, you did that to yourself, cousin. You did that. So we have to keep in mind, yes, we want to have that small waistline or whatever it is that we pay for. We want to see the results, but we have to trust the process, okay? We have to trust the process. We cannot rush the process. Because do you want to rush surgery? No. So I don't want to rush recovery. I want to recover well so I can be satisfied and very happy with my ending results, especially because all the money I endured and I had to pay, all the pain and suffering I went through while trying to recover, all the money I invested in this mentally, taking off of work, finding babysitters, all this traveling. Whew, Lord Jesus, it's like buying a new house, okay? We have to trust the process. We got to stay out of these mirrors, stay out of these negative groups. We need to wear our fajas properly. We have to wear our fajas properly. And like I said, on my next video, I'm going to be live and I'm going to wear a faja and I'm going to properly show you. Oh, that's if I still have my phones. Matter of fact, I need to be ordering some phones too. But also, I'm gonna explain the difference in the boards as well, because a lot of y'all are not ordering the correct boards, especially for my Lipo 360 patients and my Lipo 360 BBL. You want to make sure that you are ordering the correct board. Just because it say ab board does not mean that's your correct surgery recovery post-operative board. Okay, a lot of things on social media is scammy. A lot of things is not authentic. So you want to make sure you're ordering and you investing your money into the proper things that you need for your surgery and for your recovery, so you can have a smooth sailing recovery with the best results. Okay. And then you can go ahead and you can be in the mirror all you want. But I mainly want y'all to stick to your fajas. Okay. I need for y'all to stick to them fajas, because let me tell you something. Them fajas work miracles. I'm sorry. When I had my, oh my God, when I had my last surgery, well, my BBL surgery, that faja, that was my first BBL, and I was like, oh my God, oh my God. The first couple of times I took that faja off, I was like, oh, I can breathe. But then after having it off, because you're only supposed to have it off straight after surgery, only for an hour a day. Did y'all know that? You only supposed to have it off only an hour a day. And maybe a little bit over an hour, give or take, if that's the same day where you're getting ready to get a massage done and you need to go ahead and take your do your night routine, take your bath and freshen up and stuff like that. But other than that, you're not supposed to be out of that faja longer than an hour 20 and some change. You're not supposed to be out of that faja longer than that. Okay, so I don't know who's telling y'all can be out y'all faja for a few hours. No, you cannot. Not straight off the table. You need to be in your faja, cousin. Y'all need to stay in your fajas. Okay, stay in your fajas. When you have these tummy tucks, do not be rushing to get into a faja. You're going to wake up in a binder. You're going to wake up in a binder, and everybody's situation is different, because when it comes to the tummy tucks, it's 3 different type of tummy tucks. I had the extended tummy tuck. It was from left to right. Okay, so it's different types of tummy tucks, different types of surgeries when it comes to the tummy tucks, because some people don't even get muscle repair. Okay, I had to get a 3-in-1, a tummy tuck, a extended tummy tuck from rear to rear, as well as a muscle repair and a hernia repair. Okay, and a lot of you all don't know, if you know somebody that have a hernia, you can do one or the other. You can go get your hernia repair. I know back then at 305 it was 2,000 to get the no, actually I think it was 1,000 to get the hernia removed, and then you have to wait 3 to 6 months to come back and get whatever surgery it is you're trying to get. Or you can go ahead and just get an all-in-one. You can just go ahead and get the tummy tuck while they do the hernia repair, because they already in that area. You get what I'm saying? And I think I only paid like an extra $1,000. So really altogether I paid like $4,500, I want to say, for my tummy tuck, hernia repair, and muscle repair. Okay. I have like 2 or 3 cousins that had surgery last year and they are now pregnant. Congratulations. But on top of that, y'all got to be careful. Y'all got to be careful after surgery, because let me tell you something. After surgery, you are very fertile. If you can still have kids, be very careful. Be very cautious, okay? Be very. Now, one thing about the tummy tuck, as I came to realize, and I educated myself, and I did read a lot of reviews on a lot of patients that right after having a tummy tuck, they got pregnant. Their stomach did seem to go, I mean, like 90% back to normal, 90% to like after they had their tummy tuck. And of course, some of them probably had like a little, a little bit of loose skin, or a little bit, not really loose skin, but like a little bit of a little tug and war, just a little pudge or whatever. And so they'll go back and get like Lipo 360. But it's no need to go back and get another tummy tuck just because you didn't have a baby. Trust me. Once they in there and they done did all that jigsaw with that tummy tuck, let me tell y'all something. Tummy tuck ain't no joke, okay? I done had a tummy tuck and BB. I done had both of them. Tummy tuck is not no joke. Which one? Okay, so I get this question all the time. Which one would I prefer? Let me tell you something. I felt like I healed faster with the tummy tuck. I healed faster with the tummy tuck, but I feel like with the BBL, I was in more pain, okay? I was in more pain with the BBL because I think with me it was because I had thigh lipo too. So I'm using a lot of leg muscle, okay? And you know, even if with lipo in your thighs, you're using your booty cheeks, like your legs to walk. You get what I'm saying? So it's no way around it. It's no way around it. You still have to walk. You still have to, you got to get up and move around. And that's the only way. And that's what I had to tell myself mentally. Get up and walk around. This time I'm getting an Airbnb in Miami. I'm not too far from the surgery center. And I'm just sitting here thinking logical. I'm like, you know what? I want to be somewhere where I have a scenery. You get what I'm saying? Because being isolated in a room with other people at a recovery house, or even if you have a private room, or just being in a private room, or just being in a hotel room, I just feel like me mentally, I'm going to feel kind of alone. You know, like I'm going to get in my mode. I'm going to get in my mode. And I don't want to get in my mode. I don't want to go through the motion again because I already been through this. So I feel like this time around, I'm going to be somewhere where I have a scenery. I can actually see the water. I can go on the patio and, you know, just feel the breeze. And even though I can't sit, you know, I can still, like, you know, hang over the rail and just, you know, look at the sky and the birds and stuff like that. Like, I want sunlight, okay? I don't want to be confided in a room looking at these four walls. I'm not doing that this round. So, and of course, I have to tell myself I'm going to walk. I have to force myself. Like, I am very hard on myself after surgery. Very, very, very hard on myself. And that's what my life coach be telling me. She be like, you don't have to be so hard on yourself. I say, yes, I do. Because if I'm not hard on myself and I'm an adult, nobody else is going to be hard on me. Like my mom, she give me leeway a little bit or whatever, but she still gets on me. But at the end of the day, she know it's up to me if I want to take her advice or if I'm not going to take her advice. But at the end of the day, I have to be an adult, okay? I have to be an adult. And I have to realize, Krystal, you done paid your money. You done came too far. You done got cleared. You done traveled. You done did all this. It's an investment emotionally and financially. So we got to do what we need to do. So wear your fajas, okay? Do not be wearing waist trainers over your fajas. What's the point of that? What are you trying to do? Because the faja is already doing what it's supposed to do. You just had surgery a week ago. Do not be wearing your waist trainers, cousins. No, 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 no. We don't wear waist trainers over fajas, okay? We don't do that, especially not the first 12 weeks. Especially, your body is still trying to get back intact. Your body is still trying to mold itself to the shape that you had desired, okay? So, no waist trainers over the fajas. That's the lesson for today. No waist trainers over the fajas, okay? But anyways, I just want to come on here and share that with you all. If you are just getting here, it's okay. Don't forget to press the thumbs up button. Don't forget to share this video. It's your cousin Krystal, and I'm out.